Low back pain is one of the most common musculoskeletal disorders worldwide, especially among women. It can significantly reduce quality of life and lead to disability. One major cause is lumbar disc herniation, which often results from mechanical stress on the spine. In recent years, new rehabilitation techniques have emerged, and dynamic neuromuscular stabilization, or DNS, is gaining attention. This video explores a recent randomized controlled trial that investigated the effects of an 8-week DNS exercise program on women with chronic lumbar disc herniation. We'll look at how DNS impacts pain, mobility, and trunk muscle endurance, and what this could mean for rehabilitation strategies. Lumbar disc herniation occurs when the soft tissue between the bones in your lower back bulges or ruptures, often causing pain, numbness, or weakness. This condition is a leading cause of chronic low back pain, which can persist for months and disrupt daily activities. Women between 30 and 40 years old are particularly affected. The pain can be severe, and traditional treatments often focus on medication or surgery. However, non-pharmacological approaches like exercise are becoming more popular due to their effectiveness and lower risk of side effects. Dynamic neuromuscular stabilization, or DNS, is a manual and rehabilitative approach that aims to optimize the body's movement system. Based on developmental kinesiology, DNS emphasizes core stability and the coordinated function of the diaphragm. By activating the deep stabilizers of the spine and ensuring proper breathing patterns, DNS helps restore optimal movement and functional stability. This technique is especially useful for treating neurological and musculoskeletal conditions, including lumbar disc herniation. DNS exercises progress from simple breathing and lying movements to more advanced activities like squatting and kneeling, with resistance. The study recruited 30 women aged 30 to 40 years with chronic lumbar disc herniation. Participants were randomly assigned to either an experimental group, which performed DNS exercises, or a control group, which continued routine physical activity like walking or light stretching. The DNS group exercised 3 times a week for 8 weeks, with each session lasting 45 to 60 minutes. The research design included pre- and post-intervention assessments to measure pain intensity, lumbar range of motion, functional disability, and trunk muscle endurance. To evaluate the impact of DNS, the study used several validated tools. Pain intensity was measured with the Visual Analog Scale, VAS, lumbar range of motion with the modified Scober test, functional disability with the Oswestry Disability Index, ODI, and trunk muscle endurance with the McGill Endurance Test. These tools are widely recognized for their reliability and accuracy in assessing musculoskeletal health and rehabilitation outcomes. The DNS exercise program was carefully structured, progressing from simple to advanced activities. Early sessions focused on diaphragmatic breathing and basic lying movements. As participants mastered these, they advanced to more complex exercises like squatting, kneeling, and resistance training. Each session included a warm-up, main DNS exercises, and a cool-down. Progression was based on correct execution and participant readiness, ensuring safety and effectiveness throughout the 8-week program. The control group continued their usual physical activities, which included self-directed walking and light stretching. These activities were performed 3 times a week for 30 to 45 minutes, but without any structured intervention or progression. This allowed researchers to compare the effects of DNS exercises with routine, nonspecific physical activity, highlighting the unique benefits of the DNS approach. At the start of the study, both groups were similar in age, weight, height, BMI, pain levels, and pain history. This ensured that any differences observed after the intervention could be attributed to the DNS program rather than pre-existing differences between the groups. Randomization and careful selection helped maintain the integrity of the study's findings. After 8 weeks, the DNS group experienced a significant reduction in pain intensity, with an average decrease of 4 points on the Visual Analog Scale. In contrast, the control group showed no significant change. This suggests that DNS exercises are highly effective in managing chronic back pain, likely by improving coordination and strength of the deep spinal stabilizers. The DNS group also showed a significant increase in lumbar range of motion, with an average improvement of 5 centimeters. Enhanced trunk stability from DNS exercises likely reduced compensatory movements, allowing for greater flexibility and mobility. The control group did not experience similar gains, highlighting the specific benefits of DNS for spinal health. Functional disability, measured by the Oswestry Disability Index, decreased by over 26 points in the DNS group. This means participants were able to perform daily activities with less difficulty and discomfort. Improved motor control and core stability from DNS exercises played a key role in these positive changes. Trunk muscle endurance improved dramatically in the DNS group. Flexor endurance increased by 24.4 seconds, and similar gains were seen in extensor and lateral flexor muscles. These improvements are crucial for spinal support and overall movement efficiency. The control group saw no significant changes, emphasizing the effectiveness of DNS for core strength. DNS likely reduces pain by improving the coordination, flexibility, and endurance of deep spinal stabilizer muscles. By restoring balance and proper function to these muscles, DNS decreases stress on the lumbar spine and helps resolve the underlying issues of disc herniation. This approach is supported by previous studies and aligns with the results seen in this trial. Improved trunk stability from DNS exercises not only reduces pain, but also increases the range of motion. By strengthening the core and reducing compensatory movements, participants gained greater flexibility and mobility in their lower back. This is particularly important for women with chronic lumbar disc herniation, who often experience stiffness and limited movement. The reduction in functional disability means that women in the DNS group could perform daily tasks more easily and with less pain. This improvement in quality of life is a key goal of any rehabilitation program. DNS's focus on core stability and motor control directly translates to better balance, coordination, and confidence in movement. Trunk muscle endurance is vital for supporting the spine and preventing further injury. DNS exercises target the multifidus and other deep muscles, increasing their strength and endurance. This not only helps with pain relief, but also protects against future episodes of back pain. The study's results confirm that DNS is effective for building a resilient core. Other stability exercises, such as Pilates, yoga, and the McKenzie method, have also shown benefits for back pain and functional ability. However, DNS stands out for its focus on developmental movement patterns and integration of breathing with core stability. This unique approach may offer additional advantages for women with chronic lumbar disc herniation. While the results are promising, the study had some limitations. The sample size was small, with only 30 participants, and the intervention lasted just 8 weeks. Only women were included, and there was no long-term follow-up to assess lasting effects. Additionally, blinding was not possible for participants and therapists, which could introduce bias. Future research should address these limitations to strengthen the evidence for DNS. Larger studies with more diverse participants and longer follow-up periods are needed to confirm these findings. Comparative trials with other exercise methods like Pilates or yoga could help clarify DNS's unique benefits. Continued research will help optimize rehabilitation strategies for people with chronic lumbar disc herniation and other back pain conditions. For women suffering from chronic lumbar disc herniation, DNS offers a structured, non-invasive approach to reduce pain, improve mobility, and build core strength. The program's progression from simple to advanced exercises ensures safety and effectiveness. Consulting with a trained professional can help tailor DNS exercises to individual needs and maximize benefits. Summary: an 8-week DNS exercise program significantly reduced pain, improved lumbar mobility, decreased functional disability, and enhanced trunk muscle endurance in women with chronic lumbar disc herniation. These findings support DNS as a promising rehabilitation strategy. With further research and wider adoption, DNS could become a key tool in managing chronic back pain and improving quality of life for many individuals.